Hi, I'm Dr. Bill Cushing, and today I'd like to discuss some of the operational aspects of billing. This video will discuss the initial data gathering. The next video will discuss verification of benefits, and the final or third video will discuss pre-authorizations. The first step in the billing process is to obtain accurate information from the patient to ensure that the practice will be billing the correct payer for the services that are covered by the patient's policy. If the patient does not have an identified payer or identified covered services, then you must negotiate with the patient on how, when, and how much the patient will pay for the services to be rendered. If you do not get compensated, the practice's cash flow will be compromised. Your practice always needs a positive cash flow to survive. So the initial presentation of a patient to the office is an important one for accurate information gathering. The following must be obtained. 1. Patient information. 2. Copy or copies of insurance cards. 3. Copy of photo identification. 4. An assignment of benefit statement. 5. An acknowledgement of receipt of notice of the privacy practices. And 6. A patient medical history. Completed patient information should contain the following. The patient's full name. It should be the same as on the insurance card. Gender, marital status and name of spouse. Employment status, the name and contact information for an emergency contact, the patient's birth date and age, the patient's address, the patient's social security number, the name of the health plan, the policyholder's name if not the patient's, any additional policies that may cover the patient, and if the patient is a minor or an individual who has a medical power of attorney in place, the information identifying the individual responsible for decisions and payment guarantees. Copies of insurance cards are very important because they contain the group number, the date coverage begins, the member's name, the member identification number, the health plan name, coinsurance and copayment amounts, any limits on a policy, deductible amounts, and optional coverage such as dental and prescription plans. The copy of a photo ID is critical. You must verify that the patient standing in front of you is actually the policyholder. Identity theft associated with healthcare insurance information is not uncommon. The assignment of benefit statement is critical also. The patient must authorize that the practice can submit claims directly to the payer. This simplifies the burdens on the patient and ensures that the practice will receive payment for services. The acknowledgement of receipt of the practice's privacy policies must be obtained. HIPAA requires that patients must be informed of the provider's privacy practices at least one time. Practices should give a copy to the patient on the initial visit and get a signed acknowledgement of receipt. All new patients should complete a medical history which must be reviewed by a medical assistant before it becomes part of the medical record. So the initial gathering is critical. It helps you make sure that you will be able to bill correctly and receive payment on a timely basis. Well, I hope this helps. Have a good day.